some of the policies that you've championed, like the National Suicide Hotline, right? Bringing that to the 988, and that must have been an incredible kind of bipartisan challenge, right? Because it makes total intuitive sense taking care of our veterans, but actually getting both sides of the aisle to actually agree on something doesn't seem like it was an easy process. And that's, I think, where leadership comes in. If you don't mind, talk a little bit about how you get, two sides to agree on something that would actually seem pretty obvious, to prioritize.
Yeah, so a lot of people ask this question. They're like, wow, this is amazing. We now have a 3-digit mental health hotline for the entire nation, not just for our troops and our veterans, but for everybody. And it's important people know this. 988 is out there for everybody. No matter what phone you pick up, you can dial 988 in America if your loved one is having a mental health crisis. It's saved countless lives already. And I co-authored this bill with a veteran across the aisle. But people say, okay, this is great, Seth, but why didn't we do this 20 years ago? In other words, this is so obvious. It must have been really easy to pass, and you would not believe how difficult it was to get this passed. There were debates over funding because Republicans didn't want to fund the service. There were debates over whether it should be managed by the states or the federal government. A lot of Democrats wanted it managed at the federal level, while Republicans wanted it managed state by state. And these are just a couple of the debates that we had to work through. There was huge opposition to the number we chose, to 988 itself, as opposed to some other 3-digit number, because some people wanted a different number, even though we did a federal study to pick 988 as the best option. So, I mean, it's almost comical how difficult it was to get passed. The sad part, of course, is that every day that went by that this line didn't exist, more people were dying by suicide. So it's a huge step in the right direction, but I've talked about even more that we can do in mental health care. And the next thing I want to do is really normalize mental health care the way physical health care is normalized, right? Because, Phil, if I told you, hey, tomorrow I'm going to go get my annual physical, you wouldn't bat an eye. You wouldn't say, oh, you're getting your physical. Oh, my gosh, Seth, is everything okay? Are you all right? Are you sick? No, because you just go and get a physical, right? That's part of proactively taking care of your physical health. Well, we need to get there with mental health care.